Hi, everyone. Thanks so much for showing up to hear about the next part of our series on healthy heart, healthy brain. You guys know I'm very passionate about this series, having spent quite a bit of my career in the cardiovascular arena. And today we're going to focus on the 10 red flags for cardiovascular disease that some of these will probably surprise you. And it's to help give you the education and tools to advocate for your health and to be more aware and to live a healthier, longer life, right? And the book that we are using to get this information from is Healthy Heart, Healthy Brain by Doctors Bradley Bale and Amy Doneen. For those who don't know, my name is Linnea Baker. I am a board-certified family nurse practitioner. So the first of our 10 red flags is bleeding gums. And I think this one surprises a lot of people. But bleeding gums can actually, it's inflammation. And you guys know, anyone who's been following me, we talk a lot about the root cause of these chronic diseases is chronic inflammation for the diseases that are plaguing the United States. Okay, the chronic diseases plaguing the United States. And a lot of that chronic inflammation, when we look at a holistic standpoint, we can do a lot of modification by modifying our lifestyle and giving ourselves a holistic, healthy, and sustainable lifestyle. And that's a lot of what we talk about. And of course, there's always a place for Western medicine and medication. They go hand in hand, and we take it from a holistic approach. So we're using all the tools we can. So when we talk about bleeding gums, that can be a warning sign for periodontal disease. And that just means periodontal disease is a chronic infection of the gums in the mouth. And it actually plagues about 50% of Americans over 30 years old. So if you're brushing your teeth or flossing, you're eating a food like crackers or something that is more sharp or tougher on the teeth and gums, you may notice your gums bleed. So when your gums bleed, that's your warning sign that you're having inflammation, and you need to get in and get that taken care of by going to your dentist and working on ways with your dentist to decrease that inflammation. So the oral bacteria from periodontal disease can actually go into the bloodstream if it's untreated, and it can cause arterial inflammation. And when we get that inflammation in the arteries, we said that can lead to blood clots and cause heart attacks and strokes. And we had gone over that. So if you hadn't seen that presentation there, that was earlier on in our series that we talked about that whole process and how that works. And I actually, when I was at the dentist's office last time, had a discussion with my dental hygienist about how they're identifying the same bacteria that are in the mouth that are creating these problems are also linked to heart disease. We actually had this talk before I even had been reading this book. And so persons with gum disease are also at a 75 or 70% higher risk for Alzheimer's disease. And if someone already has Alzheimer's disease, they can actually have a more rapid decline in their cognition. It's about 6 times faster when they have periodontal disease. That's how impactful this is, guys. So taking care of our teeth, they say our teeth show us what's going on the inside of our body. So taking care of your teeth really does help with your overall health and wellness. Number 2, dining out frequently, guys. There was a study done that evaluated studies talking about social business eating pattern is what they called this. And it just means people who ate out at restaurants and ate restaurant food frequently. The foods that these people were eating in this study analysis was they had more red meat, they ate more pre-made meals, they had more fried foods, and they drank more sugary drinks, and they also consumed more excessive amounts of alcohol. In addition to that, they said they also took in about 475 additional calories a day. And this social business eating pattern, people in that group were 31% more likely to have that dangerous arterial plaque, and they were higher risk for diabetes and high blood pressure. So just being mindful to try to eat more at home and try to cook more at home, because even if we're eating more at home, we still have to be eating the right things. And that's a lot of what I work on with my clients. So working long hours, this one really struck a chord with me because this used to be my life, grinding it out in the clinic. You can see the girl down there with her mask hanging down on the computer, with her cup of coffee. And that just really symbolizes what my life used to be like when I was grinding it out very long hours in the clinics. And people who work 55 or more hours a week compared to those who work a 35 to 40-hour week, they're actually 13% higher rate of heart attacks. They have a 33% higher rate of strokes, and they have an increased probability of weight gain, smoking, and excessive drinking. So definitely working the very long hours put a lot of stress on my body. I ended up with an autoimmune disease, which was a culmination that was part of the unhealthy lifestyle I was living. And then definitely I had significant weight gain when I did that job and worked those crazy long hours. So it really does make a difference. And I know it's not always, everyone's not in a position where you can just change jobs, but making sure you're finding a job that also helps your overall health, because that is a big stress in our life. And we want to be able to live comfortably and pay our bills, of course, but being able to really navigate if you're not absolutely loving your job or career, or you are feeling overwhelmed by it or stressed by it, finding ways that you can adjust that for your overall health. And that's a personal decision and one with your family, but just something to be mindful of and think about. Gout. This one was surprising. I think a lot of people get surprised by this one, but they said people with gout are nearly 50% higher risk for coronary artery disease than those without gout. And so my husband's dealing with another gout flare up right now that's been going on for a while. So this is something we deal with in my family. Women with gout have a 34% increased risk of stroke. And the authors did say, though, however, that there was a large 2020 study, and that concluded, the authors from this study concluded that gout is a modifiable risk factor for arterial disease. And they based that on the findings from this study that treating gout with anti-inflammatory medications dramatically reduce the risk. So if you have gout, making sure you're following with your primary care manager, your PCP, your PCM, whoever your healthcare provider is, and taking care of it. We don't want to suck things up and let it go thinking it's no big deal, because clearly leaving this untreated is a risk factor. It gives you a much higher risk factor of having coronary artery disease. And it's when we modify it, when we treat the gout, then we're lowering our risk factors for that specific risk. Now, snoring or trouble sleeping. I talk about this a lot. Again, this happens in my household, so I'm very aware. My husband has sleep apnea. And people who have obstructive sleep apnea typically will snore and also awaken frequently and not realize why they woke up at night. And they'll wake up in the morning not feeling rested. And most people who have obstructive sleep apnea, they don't realize it. It's their partner who notices it. So I was the one that told my husband, you need to go get a sleep study. I'm telling you, you snore like crazy, then you stop. And it's like, I have to check on you to make sure you're breathing. And sure enough, his sleep study was positive. So just something to keep in mind. We talked about this before, that people with obstructive sleep apnea, this is actually one of the most common root causes of having high blood pressure that is not responding to prescription medications. So if you have high blood pressure and you're being treated and it's not responding, definitely consider talking to your partner or talking to your doctor, and definitely letting your doctor know, like if you snore and things, maybe that's something to consider in your case. That was something I understand. Obstructive sleep apnea, there's a lot of overlap with that, with cardiovascular disease, even back when I was working in cardiology. But I didn't realize the blood pressure link, and it makes sense. And now I think back to all the clients that we used to take care of. That would have been good to know for sure if that was an issue. And of course, if you get diagnosed with the obstructive sleep apnea, you actually have to use the equipment, the CPAP or whatever they prescribe for you to utilize, because that's how you treat it, to lower these risks and also help treat the blood pressure if you're one of those people that's having trouble with your blood pressure. They said there's several studies that show obstructive sleep apnea actually doubles the risk for heart attack, strokes, and cardiovascular events. So it's definitely worth having an evaluation, having a sleep study if you're thinking that you may fall into that category. and then treating it, making sure you're following the prescription, whatever that prescription is for whatever equipment you need to treat it. Usually it's CPAP, because if you're not using it, it's not going to eliminate the excess risk. But if you do treat it and follow the treatment protocol given by your doctor, then yeah, you can definitely eliminate the excess risk. So that's a motivator right there. So hopefully my husband's listening to this talk. So number 6, migraine headaches. This is another one that I think surprises people. About 30 million Americans, and actually 3/4 of that, 75% of them are women. They suffer from migraines, and they define migraines as debilitating recurrent headaches, which are sometimes accompanied by the nausea, sensitivity to light, or weakness. And migraines with an aura more than doubles a woman's risk for stroke and quadruples it if she's under 45 years old. So those are really scary numbers. And when I talk about an aura, they define aura as the flashing lights, the zigzag lines, or a disturbed sense of smell, taste, or touch. Okay. And women with migraines, this is key. And most of, healthcare professionals in general know this. It's part of our standard of care. But just to empower and notify you, women with migraines should not be using oral contraceptive pills because of the increased risk for blood clots and strokes. So there's other methods of contraception if you're looking for that, and you can talk with your healthcare provider who's managing that. But oral contraceptive pills definitely is a no-go with migraines. Okay, psoriasis and other autoimmune disease, number 7. So psoriasis is a type of autoimmune disease. It's typically presents with the plaque-like skin rash is one way that it's noted. And it affects more than 3 million Americans, guys. And when people have psoriasis, they're at increased risk for high cholesterol, high blood pressure, obesity, diabetes, and metabolic syndrome. They're seeing in the studies and research, this is all linked together. In severe cases of psoriasis, people can have 2.5 times higher risk for fatal heart attack or stroke. So very serious to be aware of this link. I know we did an evaluation early on in the beginning part of this series where we did a questionnaire of what your risk factors are and autoimmune diseases on it. And I have autoimmune disease, so this puts me at risk too. So I'm not only teaching you guys, I'm also looking at how to keep myself healthy and also improve my husband's health and my family's health, right? So people with psoriasis, they actually may have early onset of cardiovascular disease events by the age of 40. Which is scary. So just being mindful that if you have psoriasis, you're in that higher risk category, and making sure you're doing the things to be proactive in your health that we've discussed. Autoimmune disease, 20% higher risk of cardiovascular disease and diabetes. Again, that I fall in the autoimmune disease category. Women with lupus diagnosis. There was a 2018 study that found young women with lupus were 50 times more likely to die from a heart attack than young women without lupus. So again, being mindful and being able to modify and take care of the things we can take care of. And one of those is treating chronic inflammation. And that comes down to meeting with your personal healthcare provider and your specialist managing your chronic disease. Your autoimmune disease is usually a rheumatologist, and having these discussions with your rheumatologist, with your primary healthcare provider, and finding ways to be proactive, but also a holistic lifestyle comes into this big time when we talk about chronic inflammation and chronic disease. Okay. And then Crohn's disease is the least of the autoimmune diseases, has the least cardiovascular impact, not the least disease, but in all of the types of autoimmune disease out there, Crohn's disease, that particular one has the least impact on cardiovascular disease, whereas lupus is higher and psoriasis is higher. Okay, erectile dysfunction. This is something we saw a lot in cardiology, and it's actually one of the most common early warning signs for arterial disease in men, okay? If a man has erectile dysfunction or ED, that doubles the risk for cardiovascular disease in the next 3 to 5 years. And that's a separate independent risk factor, separate from high blood pressure, smoking, or high cholesterol. So a lot of people go, well, why is that associated with it? It has to do with the blood flow. These are smaller blood vessels. So typically, That's where the smaller blood vessels or the microvascular disease is where you typically notice the arterial disease first. So this is one big warning sign or red flag that you need to be checked by your healthcare provider and get a workup done. So is it preventable? Yes, you can prevent erectile dysfunction by modifying your risk factors, because many of the same conditions that cause our arterial disease and this microvascular disease are the same things causing erectile dysfunction. Those are smoking, obesity, having a low vitamin D, having high cholesterol, and obstructive sleep apnea, to name a few. So when we work on these holistic approaches and living a healthy, sustainable, holistic lifestyle, and then also working with our personal health care providers to make sure we're maximizing all the tools we have to be proactive instead of reactive. Okay, number 9, asthma. You guys might really be surprised by this one, but asthma affects up to 25 million Americans, and asthma is a disease. It's inflammation of the lungs. Okay, so we keep talking about this chronic inflammation. Persistent asthma symptoms can double your risk for cardiovascular disease events, such as the heart attack, stroke, or some other arterial disease complication like we've been talking about. Again, it's chronic inflammation. That's what asthma is. It's inflammation of the lungs. And they say that patients with persistent symptoms of asthma requiring daily treatment had higher levels of systemic inflammation than those with intermittent symptoms. So making sure you're working with your healthcare provider or specialist like a pulmonologist, and working on ways to get your inflammation down to stabilize your asthma, and to also work on holistic lifestyle approaches to decrease overall inflammation, right? And number 10, divorce, guys. And we're going to end on this one because it was a little bit, I mean, it's sad, obviously. I never want to see anyone have to go through a divorce. That's not why we get married. Most people get married never thinking they're going to end up not staying together forever. But with divorce, there was this 2015 study that said in women, 1 divorce raised the risk of a heart attack by 30%, and 2 divorces in a woman's life doubled the risk in women. But in men, they had to be divorced twice before they had any increase in heart attack risk, ladies. So I just thought that was funny. Just when we look at different risk factors based on our sex, right? So it cracked me up a little bit. But just to let you guys know, that's a summary of like the 10 different red flags that we need to be paying attention to, and things that you don't normally think of. People typically think of maybe weight, diabetes, they'll think of blood pressure and cholesterol issues, definitely, but there's so much more that we need to be paying attention to that puts us at much higher risk of having these cardiovascular disease type events like heart attacks and strokes. And what can we do to improve our overall health and hopefully prevent that from happening and protect our arteries? So I hope that this brought you value. I am here to bring education and help make you an advocate for your health. But remember, this is not to replace any guidance or information or things given to you by your personal healthcare provider or your specialist. They know you best. So take the knowledge, the education, take the book, bring it to your healthcare provider or specialist. It's okay to ask questions. You should be asking questions and be participating in your own health and treatment plans. But again, they know you best. So take this information and apply it by talking with those that are taking care of you, whoever your personal healthcare provider is and/or specialist. Okay. I'm on a mission to positively impact your health and wellness through education and coaching to create generational health, and a health span that equals your lifespan is the goal, right, guys? Reach out to me for a free health consult, and you can do this by commenting below or private messaging me. I truly am passionate about helping others from a holistic standpoint, looking at a holistic lifestyle approach to improving your health. And obviously, there's always a place for Western medicine, and I'm grateful we have the resources we have in the United States. So guys, I hope this brought you value. Thank you for your time. Again, this is the book I'm getting this information from. I'm only taking snippets of it. This book is packed full of information. It's written for lay people, so people with no medical background. It's written for people, for patients and persons who want to be proactive in their health, or who maybe have already had it and unfortunately gone through an event like a heart attack or stroke, or already know they have arterial disease. So go ahead. I got this book on Amazon. I have nothing to do with the book other than I read it and I just lit up because there's so much information in here that can really help us live a healthier life and be holistic and proactive in our health. So again, guys, thanks so much for showing up. I hope this brought you value, and be safe. I'll see you again soon in working on the next part of this series. Okay. And I'll see you in about a week.